being a high-tech company with innovation being sort of leading the charge, we thought about how do we take information and technology and integrate it to drive consumer behavior and drive it to the individual's desktop. So our journey began with introducing and creating a personal health record and an interactive health portal that was personalized to the individual. So the first of its kind, and at the time there was a lot of naysayers. First of all, other employers looked at us and thought, oh, that's very risky to start to take, integrate the technologies, bring in information together, and then deliver it to the individual. And privacy was certainly a concern. But again, we believe that transformation in the healthcare marketplace really starts with innovation. So we continued on the path. And over the past 6 years, we have driven and have evolved our personal health record, and today are incorporating other very intriguing features such as remote patient monitoring and bringing in imaging and lab results and making it much more of a patient-centric personal health record versus just a static tool or tool that employees may go in maybe just to look at data on a regular basis. So really driving behavior through the use of technology and information. The SmartBeat program is a program that's focused on remote patient monitoring for hypertension, and it's a wireless cuff that the individual measures, takes their blood pressure reading on a regular basis, and transmits that information into a health portal. And that information is then viewed by clinical staff and guidance on perhaps if the blood pressure is high today, perhaps the individual needs to take much more of a exercise regime, or maybe cut back on their salt, or maybe speak with their provider, or perhaps there wasn't good compliance on the medication. So it delivers very targeted information at the individual level based on the readings that are transmitted into this health portal. When we launched the remote patient monitoring pilot program, we had just an overwhelming response, and we were limited because it was a pilot just to a certain number of individuals. And that really, I think for us, crystallized the fact that, employees are, or consumers are, ready to embrace new technologies, and the individuals that are participating in the program are sending their blood pressure results on a regular basis. We are almost a year into the program. So far, measuring the results of the program, we've seen just less than 1% of individuals that are just opted out of the program, but otherwise employees are still very engaged. Compliance has been phenomenal. Individuals were taking blood pressure readings at least 3 times per week. So if you think about that, where now we understand and we know that there's action on a regular basis of taking a blood pressure reading, receiving the messages from the interactive portal, giving them information or tips, or perhaps having them engage with their provider on a discussion about maybe a change of diet or just a change of regime, where before they may not have been monitoring their blood pressure. So these types of innovative technologies are really a driver to individuals taking on a little bit more responsibility. Data is very important. Understanding the cost drivers and understanding where you're spending your money as an employer is key to any conversation with finance, especially when you're looking for funding. So for us, as an example, when we looked at hypertension, and the data indicated that over 4,000 individuals were hypertensive, and that translated to about $3 million just for hypertensive type of claims. Then when you further looked, we looked at the data, and cardiovascular disease, nearly $13 million. So those are very large numbers to engage in a discussion with finance. Also, it's not only measuring or looking at the claim dollars or the utilization, but also the fact that those individuals eventually may be out of work. They may have to take time off. They might be on disability, short-term disability, or long-term disability, or even if they're at work, they may not be there because they're not feeling well. Over the period of 6 years, we've measured our success of integrating technology to drive consumer behavior, and really supplemented that with a number of other programs. And when we looked at our strategy or our approach in total, we saved or contained $111 million worth of cost over a period of 6 years. And we've measured that with our trend versus the national trend, and measured on a per capita basis. So pretty impressive. So preparing a business case for finance requires quite a bit of education to the individuals and a lot of data. So as an employer, having access to data that you can translate into action and into a business plan with finance becomes increasingly important. Continue to accelerate the adoption of healthcare IT, of personal health records, remote patient monitoring, integrating it. The pilot program has worked very well. We are now looking to integrate it into the personal health record, where it now becomes a permanent part of PHR. Starting to engage providers to be partners with EMC, because they're treating EMC employees on a regular basis, and we'd like for us to be much more involved, and not in directing care, but in helping in the adoption of technologies, both at the provider level as well as at the employee level. Imaging, bringing in imaging into personal health record is something that's on the horizon right now as well. And bringing in lab results so that the personal health record at EMC becomes a personal health record for life, which is different than a personal health record or an electronic medical record at the provider level, where if an employee is changing networks or perhaps moving from Boston to San Diego, that record gets lost, where the personal health record now becomes the central repository of this data collection about the individual. So we'll continue to invest in personal health record. We'll continue to invest in technologies, new and innovative technologies that will help to create a much more patient-centric delivery system. Talking about the challenges of the healthcare marketplace, the challenges within the employer community paying for the majority of the bill, the challenges at the consumer level, at the patient level, who's also paying for a portion of the bill. So talk to employees about the path or the roadmap for the next 5 years, what they can expect and how they'll benefit from a strategy. Bringing in credibility into the organization with, within the local community, names that they recognize, driving it from the senior management level down. That's key. So getting adoption at the CEO level and at the chairman of the board level, because then it becomes ingrained in the culture. It's not the benefits organization. Illustrating the value and the benefits to all stakeholders. Helping employees to understand that healthcare costs are a business issue, and it's also a personal issue as they're paying a portion of that bill as well, and it's a societal issue. So getting the consumer engaged in healthcare delivery, in the same way that they're engaged in purchasing a car or purchasing any other type of product or technology.